Firstly, I'd like to acknowledge and pay my respect to the Yarra elders, past, present, emerging, where I live and work, and also like to extend the acknowledgement to all traditional owners of the land we are meeting on today, to their elders, past, present, emerging, and to all Aboriginal and Torres Strait Islander people who may be watching this presentation today. I also would like to acknowledge the stolen generation, past, present, and to their families. Hello everyone, my name is Roslyn Malay. I'm a Yudiyangam Gija woman from the Kimberley region of Western Australia. I have been working as a researcher for the University of Western Australia Centre for Health and Ageing for 10 years. The areas of research that I have been involved in are healthy ageing, the health and well-being of carers, and detection of cognitive impairment and dementia in Aboriginal and Torres Strait Islander communities. Until recently, I have also been the co-chair for the Aboriginal and Torres Strait Islander Ageing Advisory Group, which is part of the Australian Association of Gerontology, AAG. In this webinar, we are going to talk about the health and well-being of carers of people with cognitive impairment and dementia, otherwise referred to as memory and thinking problem. This webinar is part of a research project called the Let's Chat Community Health Approach to Dementia in Aboriginal and Torres Strait Islander communities. The primary aim of the Let's Chat project is to increase detection of cognitive impairment and dementia by raising health service staff awareness and increasing health service staff knowledge and skills for preventing, detecting, and managing cognitive impairment and dementia. The other aims are to optimize and manage the support of people with cognitive impairment and with their carers, family, and the communities. Next slide, please, Dina. The Let's Chat Dementia team developed a best practice guide to cognitive impairment and dementia care for Aboriginal and Torres Strait Islander people in primary care. That has now been approved as an accepted clinical resource by the Royal Australian College of General Practitioners. The guide has a clinical and cultural foundation, and all the webinars presented are based on the guide. Highlighted in blue is the webinar we are presenting today, Health and Wellbeing of Carers of People with Cognitive Impairment and Dementia. We ran part 4 in our season last November, which focused on prevention and health promotion for cognitive impairment and dementia. The key takeaway message from webinar 4 was that there are many things we can do as individuals to reduce our risk of getting dementia or cognitive impairment. We can focus on protective factors such as regular exercise and eating well, and stay away from the many risk factors that are modifiable. For example, giving up smoking. We also saw that brain health should be a focus across the life course, and that primary health care can play a large role in this. Today's webinar is about the health and well-being of carers of Aboriginal and Torres Strait Islander people living with cognitive impairment and dementia, thinking and memory problems. We'll discuss who we're referring to when we talk about carers. We'll also look at the carer needs of the person with dementia and the challenges that a carer of a person with dementia or cognitive impairment may face, including culturally specific elements. We will look at how this can impact on their carer and the health issues that carers often have themselves. Finally, we'll give some suggestions of the ways that the health service can best support the health and well-being of carers. Some of the main learning points we would like everyone to take away from this workshop are to be aware of the issues that carers may be facing and the specific support that they may require, which make sure that carers are regularly assessed and linked with appropriate and support in a timely manner, and that culturally appropriate tools are used. It is also important to have elder abuse on their radar. And lastly, to recognize family and caregivers are the most important resource available for people with dementia. Many of you will already be familiar with the following information. However, so we can ensure everyone is on the same page, I'm going to outline the definition. A carer is a person who gives someone regular and ongoing care and support. They do this often without being paid, although some might receive a carer's payment. A carer could also be a family member, a partner, a friend, or a neighbor. And in many cases, it is expected and it is our cultural responsibility to take on the role of caring for our elders. There are also people who are employed to provide care to an individual. This type of care may be referred to as care aid, care worker, or formal carer. The focus of this webinar is on the first type of carer, not care aid, care worker, formal carer, or carer agency. As many of us know, when someone gets dementia, they may start to do different things and behave different ways. Here are some examples. They may start to get lost more frequently, feel worried or frustrated and not know why. They might feel disconnected from family and other people. Their sleep can become disturbed, and they may have difficulties with caring for themselves and toileting. They can get grumpy and say things that they wouldn't have said before, do things that they wouldn't have done before, such as culturally inappropriate behavior. It's common for a person with dementia to forget things and that they have already said, or forget to take their medication, and also to forget family names. They can have trouble with everyday activities like doing the shopping, managing finance, and even eating. Caring for a person with cognitive impairment or dementia is very challenging. The carer has to accept the differences in the person as part of everyday life. Family members and friends may find this frustrating because they don't understand why the person with dementia is doing the things that they do. For example, for some communities, it may be seen as embarrassing that the person has dementia, as it might be seen as a payback for cultural wrongdoing, and it is not seen as a sickness of the brain. Next slide. The demands of caring for a person living with dementia are high, and carers commonly experience ongoing grief as the condition worsens, and the needs of the person living with dementia increases. Carers experience chronic grief. They are grieving the loss of their family member because they are not the same as they were before the dementia. Carers may also experience frustration, tiredness, social isolation, and financial pressure. Many carers also experience guilt at not being able to do enough. Missing work and school is common because carers need to be available to provide care to attend appointments, and the carer themselves often have ill health. The carer might be untrained and may not understand the disease properly. This is why it is important to identify, educate, support, and distress carers as dementia worsens. The person with dementia loses the mental capacity to make more complex decisions, and the carer becomes the decision maker, often being responsible for many decisions concerning the person's health and finance. It is important to remember, while there are many challenges associated with caring, the role of caring can bring joy, personal growth, and a feeling of being close to family. Another challenging area that is related to caring for an older person with dementia that needs to be mentioned is elder abuse. Some evidence suggests that abuse of older Aboriginal people is on the increase. Financial abuse is most commonly reported and is linked to issues such as poverty, substance abuse, and the breakdown of strong family structures. Elders may feel shame and may not want the community to know their business, family business, and may keep their abuse hidden. Next slide. What do we do about elder abuse? Preventing and responding to elder abuse is often best addressed within the community. Getting help and support of trusted and respected family members or the community is important. It is the best way to achieve cultural respect, and that means there is a higher chance that planned strategy will be implemented. If you are a service provider using a partnership model where possible, can improve action to safeguard an older Aboriginal person. This approach is more effective and culturally safe. For example, sitting down with the older person, the family, community elders, and service providers. You can all look together at strategies for keeping older persons safe. I will now hand you over to Dr. Wendy, who is going to talk to us about the health and support issues that carers often deal with and provide us with some ideas and resources to address these. Thank you.
May I start with acknowledging that I'm meeting on Gumbaynggirr country and you're all meeting on other traditional lands. I pay my respects and acknowledge the wisdom of elders who have passed, those of today and those of tomorrow, and extend my respect to all Aboriginal and non-Aboriginal people at our webinar this evening. I'd also like to thank the elders that have guided our work and give permission to me as a non-Aboriginal person and researcher to speak about ageing related issues. So we're going to start off with some common carer health issues. The challenges associated with caring for someone with cognitive impairment or dementia have a direct impact on carers' health, with caregiving being considered actually a chronic stressor due to the persistent and often physically demanding caregiving tasks, as well as the emotional toll of caring for a loved one, and often with a debilitating illness as well. Results of a caregiver study of people caring for a person living with dementia, living in remote communities in the Kimberley, reported considerable stress, depression, and actual carer burden. Chronic stress, we know, is associated with severe adverse health outcomes, often severe adverse health outcomes, and it includes adverse health outcomes like high blood pressure, poorer immune status, and increased mortality. Therefore, carers often experience poorer health outcomes with significant impact on their physical health and mental health, especially depression and anxiety and overall quality of life. A recent study cited demonstrated that approximately 40% of family carers of people with dementia have clinically significant depression or anxieties. Others have important but less severe psychological symptoms. And you can see the references for those studies that I've just cited on the slide there, and that'll be available on our website after the presentation. The effects are broad. Carer depressive and anxiety symptoms affect the carer and the person with cognitive impairment or dementia, and also the wider community. Further, it's predictive of care breakdown as well. Spouses of people with dementia have a higher risk of developing dementia themselves. One study has demonstrated that carers looking after their spouses aged between 66 and 96 who reported caregiver strain had mortality risk that were 63% higher than non-caregiving counterparts. Next slide, please, Dina. So looking here at some considerations in relation to culture and care, many of the points on this slide are taken from the Best Practice Guide to Cognitive Impairment and Dementia Care for Aboriginal and Torres Strait Islander people attending primary care that Roslyn introduced you to. This guide that I just mentioned went through a Delphi process with significant input from Aboriginal and Torres Strait Islander researchers and service providers, and has got both a clinical and cultural foundation. And as Ros mentioned, it's part of the Let's Chat Dementia project study. But many Aboriginal and or Torres Strait Islander peoples are caregivers because of cultural and family responsibility. And there are often strong Aboriginal and Torres Strait Islander family support systems for elders with thinking and memory problems. Elders play a really important role in keeping the family together and passing on cultural knowledge and language. Therefore, it's really important to many families to keep the older person in their community and on country for as long as possible. Care responsibility might often be shared by many people within a community. Many carers of Aboriginal and Torres Strait Islander people might experience problems accessing much needed services. That's often due to a lack of services in remote areas, a lack of transport, and also because we see services which have not been adapted to meet cultural circumstances, such as local languages, or the services are deemed not to be culturally safe, and therefore the older person doesn't want to access those services. Older people looking after Aboriginal and or Torres Strait Islander people with cognitive impairment or dementia often have the added responsibility of looking after grandchildren in the community, as well as others in the community, while younger people in a care role often have young families to look after themselves. Aboriginal Australians are also more likely to look after another person with a disability, long-term illness or ageing-related problem than non-Indigenous Australians. So you can see the issues are complex and many. Aboriginal carers in communities are relatively young, and most are children or grandchildren to the person they're caring for. On average, Aboriginal carers in remote communities are 10 to 15 years younger than their non-Aboriginal Australian counterparts and throughout Australia. Older and younger carers looking after an Aboriginal person with thinking and memory problems are often Indigenous themselves and can have complex health and social issues of their own. Frequent deaths within families, illness and accidents also impact on carers' morale. Older Aboriginal and Torres Strait Islander peoples may not want to be looked after by their children or family members. So, as you can see, the considerations for culture and care are complex. Next slide, please, Gina. Thank you. We're going to have a look at the case study that, if you have been to the previous webinars, you will have met Aunty Molly in the case study. So this case study was designed to provoke some thought about how carer stress or burden affects the carer and the person with cognitive impairment or dementia. And it's an opportunity to think about how health workers might respond. So we've met Aunty Molly. She's a 68-year-old lady living with her son, Frank, and as I said, we met her in the earlier webinars. Aunty Molly was diagnosed with Alzheimer's disease 2 years ago. She often repeats herself, and her family report that she misplaces things and then accuses her family. She sometimes has episodes of urinary incontinence, especially at night, and also has osteoporosis and severe osteoarthritis. She wakes up usually about 3 a.m. in the morning, thinking it's time to go to the shops and to the cultural centre that she's very involved in. Next slide, please, Dina. So what are the issues going on for Aunty Molly? What issues does she face? And how would you, in the care role, respond? So Aunty Molly has got some health needs, an expression of her unmet needs. She would need some regular primary care, some pain review and some medication review. She would need personal care, assistance and review, and hopefully some home care support could be activated. She's had a series of missed appointments as well, we noted. So again, in the care role, you'll be looking at some home care support and looking at informing the carers of her appointment times and some reminder system in place, and organising transport to get to those appointments if that was available in the area. Her general health and wellbeing, she's got some complex health needs there which need to be attended to. She needs some assistance with her urinary incontinence, perhaps some continence supports, continence aids, and also reviewing her osteoporosis and osteoarthritis. She really needs a regular primary health care review and a geriatrician referral for overall assessment, not forgetting her social wellbeing. Aunty Molly needs some social supports, thinking about, is there a cultural centre in the local area or nearby area? If there's not an actual centre, there may well be some elders groups that are operating that Aunty Molly might be comfortable to go to. Okay, so let's think about the issues for Frank and his family. Think about how Frank and his family could be supported. Frank also has some complex health needs. He's got diabetes, so he needs some regular primary care and mental health care plans as well. He's got some competing time commitments, time and care commitments, caring for his mother and for his children, as well as some time and work commitments on his work as well. We're seeing that he's losing sleep with mum waking up at 3 in the morning, wanting to thinking it's time to get up, ready to go to work. So that disrupted sleep, perhaps we would be looking at some respite and then helping Frank manage his sleep patterns. And he actually says at one stage that he thinks he's at the end of his tether. So we'd be looking at some counselling for Frank, some perhaps stress or grief counselling, referring somewhere like Carers Australia, and looking at the health service mental health plan and actioning that for Frank to give him some support. So next slide, please, Dina. Thank you. So this slide outlines some of the main points that I've just covered, actually, why carer health needs to be central when considering the health of a person with cognitive impairment or dementia, their family and the community as a whole. The reason that it's important to care for the carer are numerous. We need to be reducing carer burnout. Supporting carers improves the quality of life and health outcomes for both the carer and the person with cognitive impairment and community and the whole community. The carer's quality of life and health outcomes can be improved with connection through respite services, counselling and at-home support. And this has the flow-on effect of improving the quality of life and health outcomes for the person with thinking and memory problems as well. As I mentioned earlier, carer mental health issues are actually predictive of carer breakdown, and therefore looking after carer health can decrease residential care admissions and elder abuse. Elders can stay on country and in the community for longer. Most people like family members with dementia to continue living at home for as long as possible, and people with dementia have a better quality of life when they do. It's for these reasons that it's important to prevent and manage symptoms connected to carer burden. Next slide, please, Dina. Okay, I think we want to, and next slide, please. Current clinical recommendations for carer health are outlined in the best practice guide for cognitive impairment and dementia for Aboriginal and Torres Strait Islander people attending primary care. As I said, that guide went through a Delphi process, and as Ros said as well, it's now been accepted as a clinical resource by the RACGP. Recognition of carer-related needs, like the connection of carers with needed support services and other things we've just been discussing, are really important. But accessing the right services, medications and payments are also things that you as carers can help the carer of the person with dementia access. Regular assessment of the carer health and wellbeing is also critical. Care would include screening and preventative health strategies. Carers We know that carers of Aboriginal and Torres Strait Islander people are often Aboriginal and Torres Strait Islander people themselves, and therefore need general primary health care to support their own health needs that may be complex, as we demonstrated with Frank in our case study. It's important to be aware of the availability of culturally adapted tools and assessment tools, and it's important to use those culturally appropriate adapted tools for screening. And the other thing here is Aboriginal and Torres Strait Islander carers aged 50 and over also need to undergo age-appropriate case finding for risk factors for thinking and memory problems. Next slide, please, Tina. The Let's Chat team have created some resources to be used when putting together a GP management plan for patients with chronic conditions that include brain health and dementia care recommendations. We've also created one for carers. When looking after the health of a carer, you would make sure you do all the normal health checks that you would normally do, like healthy lifestyle, social and emotional wellbeing, medication review, etc. Some of the differences would be doing cognitive screening for those aged 50 and over, like I just mentioned, or earlier for those with higher risk. Assessment of carer burden and strain, and ensuring that the carer has access to support programs and other support such as respite, like we mentioned for Frank in the case study. It's been shown that carer respite can enhance carer wellbeing and assist carers to continue in their caring role. And that's that slide there was a snapshot of the website. Thank you. Next slide. Thanks, Dina. Care support, what works? Support services that help look after the person with dementia and therefore reduce the amount of work provided by the carer. For example, cleaning, food delivery, etc. And also other family members spending time with the person with dementia. These types of responses reduce the amount of care that the carer needs to provide and are focused on the person with dementia. Support services for the carer that help with carer stress, quality of life, physical health, loneliness and depression. So thinking about the whole range of support that the carer might need. The carer might also have a lot of the same risk factors for cognitive impairment or dementia and other morbidities. Therefore, it's really important that the carer is receiving regular general primary health care. And if needed, the carers are connected with counselling and carer support groups. Programs that have been shown to work well are tailored and are part of ongoing care and support. Increasing knowledge about dementia is always really important as well. Education about the behaviours and symptoms of the person living with cognitive impairment and dementia can increase the understanding and provide skills for carers to know how to respond effectively to care needs and thus decrease distress and negative impact of care on carer wellbeing. However, information by itself is not enough, and home care and respite services are also deemed to be essential. Community-based care has been shown to have many benefits, like creating a greater sense of empowerment and wellbeing. And there are programs that take into account culture and tradition. Next slide, please. One of the best ways to support, thank you, carer health is to ensure that carers are connected to the appropriate services and resources. What does your health service offer to carers? The first place to start is your own health service. Thinking about what types of services are available for carers. For example, perhaps there's a carers group or a counselling service. Dementia Australia provides a lot of support services that can be accessed over the phone or online, such as the National Dementia Helpline, advice and counselling, carer education and support programs. The Caring for Spirit website has a page on caring for a person with dementia that has a lot of good tips and links. And the references for these will be on the last slide. Dementia Support Australia is similar and has developed a guide for family carers to help them deal with psychological symptoms. That is a very useful resource, and also has a family carer help sheet focusing on Aboriginal clients. My Aged Care is another important consideration. Aboriginal and Torres Strait Islander people are eligible to access My Aged Care from the age of 50, and the health service can make referral for patients to be assessed, determine their eligibility for aged care services. So that's a really important one to remember, My Aged Care from age 50. Also, we would be recommending that you look at local counselling services and local respite services. If available, it's also important to link up carers with community-based care support. This will allow the carer to receive the support they need while the person with thinking and memory problems stays in the community. Next slide, please. One before, I think. Thank you. This slide here, some resources for families and carers. There are some useful ones. The one on the left, Deadly Tips for Stress Less, is from the Aboriginal Health and Medical Research Council. The one in the middle is a poster from Dementia Support Australia that illustrates support concerning aggression. There's several other posters available as well, such as one focused on depression and resistance to care. The other resource is from Dementia Australia, and it's things to do, activity ideas for carers, and it's an Australian government initiative there. So links to each of those resources are provided at the end of the slides as well. So some key messages. Next slide, please, Dina, when you get to it. Thank you. Looking after carer health and wellbeing is an important part of dementia care. Supporting carers improves the quality of life and health outcome for the carer, the person with cognitive impairment and dementia, their family, and the entire community. It's important that health service staff can effectively identify, educate, and support distressed carers. Connecting carers with culturally safe services is essential.